Welcome everyone to our virtual event featuring Sofwave for lifting and skin tightening. My name is Hillary Lebouitz-Schaefer. I am one of the owners here at Lébo Aesthetics Spa. I'm also a medical esthetician and I perform the Sofwave procedure. Please stay tuned as we go through this webinar. At the end, we will have time, about 15 minutes, for questions and answers. Please feel free. There's a little question box to ask your questions. I will be live being able to answer them. So you definitely want to stay tuned till the very end. So what does Sofwave do? So Sofwave uses ultrasound heat with 7 parallel beams to deliver that heat to the mid-dermis. What's important with that is that's not where fat lives, so it won't melt fat. It doesn't cause volume loss, but it does help to generate collagen, elastin. It helps to lift and tighten the skin without any downtime. So why do we bring it into the practice? We did find that a lot of patients that were coming in wanted something that was non-invasive, and Sofwave is non-invasive. Maybe they're thinking about having some type of plastic surgery, but they're just not ready. So that's the beauty of Sofwave. There is no downtime. No one knows that you had anything done, but it does create that lifting and tightening over that period of up to 6 months. So it's amazing. It really has great results without having any of that downtime. So another question that we get asked is, how is it different from similar treatments or devices? So what makes Sofwave stand out is that it does deliver that heat to the mid-dermis rather than below where that subcutaneous fat is. So there's been a lot of talk about how some of these devices melt fat and they make the face actually kind of age faster because you're taking some of that volume out. Sofwave doesn't do that because it's not treating that subcutaneous fat. It's not targeting that. It's above that in that mid-dermis, which is where you're going to be stimulating the collagen and the elastin. So you get that lifting and tightening, but you keep your volume. What can Sofwave treat? So Sofwave can actually treat the face. We can do the brows. We can do like the mid-face and through here, that jawline. You can do the neck area, but you can also do other body parts depending on where there's that crepiness. We do need to have, consultations on some of those other areas because we do custom areas as well. But most people do the face, which is the neck, that jowl, mid-face, and brow. So I do get a lot of patients coming in right now that are on GLPs, or they're just starting GLPs, or they're kind of weaning off of GLPs, and they do have some volume loss. Well, Sofwave is great for that because it gives that lifting and tightening to that area that you've lost that volume in. Who is a good candidate? Honestly, anyone. I've done, patients that are in their early 30s that want to prevent the loss of the elasticity. And then I've also done women and men that are in their 80s that already have a lot of volume loss, but they want to get some tightening in there. So really, anyone is a candidate. Is there any downtime? And when will a patient start to see results? So to answer the downtime question, there really is no downtime. I've had I had a male patient not long ago that went golfing right after he had his treatment. You're not really red when you walk out. I've also had women do it kind of over their lunchtime. So there is nothing that you have to refrain from doing. There is no extra redness or anything. You might be slightly pink and where I just finished off, but other than that, by the time you get home, no one will know you did anything. And then as far as when will you start to see results? Results usually start about 8 weeks. And then we do a follow-up again in about 16 weeks. And then we do one more follow-up in 6 months. 6 months is your full results. That's kind of where you're going to like cap at. But then, some people are lucky and they really start to see a change in about 8 weeks. So everybody's different, but definitely 6 months is the full result. Hi, it's nice to meet you. I'm Hillary.
Hi, Danielle.
What brings you in here today?
Well, at my age, I've noticed things have started to fall a little bit, and I would love to have, things lifted, my, chin area, my eyebrows, something that's not going to take, a long time to recover.
Okay.
A quicker procedure. I work, so I don't have a lot of, time available.
Sure, absolutely. You're a perfect candidate for Sofwave. Sofwave uses a ultrasound heat that goes down to the mid-dermis, and it allows you to then produce collagen and elastin. It helps to lift and tighten the skin. Mm-hmm. So if you look in the mirror here, we can give you a little bit more of like an enhanced jawline. It'll help to lift this area. Mm-hmm. It'll lift this up in here to pull that back a little. Mm-hmm. It'll also give the brow a little lift in here. Okay. So you're a great candidate for it.
Okay, that sounds great.
All right. Thank you everyone for attending our virtual Sofwave event. I hope you enjoyed it. I hope you learned a lot. Please stay on if you have any questions and ask them in that question box. I'm going to be here for the next 15 to 20 minutes live to answer anything that I can. Thanks again for attending. I really appreciate it. Hi everyone. I hope everybody can hear me. Thank you so much for joining our Sofwave webinar. I hope everybody enjoyed it. I am getting like a lot of questions on here, so I'm going to go ahead and start answering some of them. Okay, let me go here. So one of the questions is, how long do the results last? So great question. So as far as the results, it's one of those things where when you recollagenate, you don't just lose that. It's always going to be with you. But at the same time, we're still aging. So I like to say that it's something that you want to have done every so often. I have some patients that want to do it every year. They just want to keep things really, really tight and kind of just stay ahead of everything. I have other patients where we do it about every 2 years or 3 years. It also depends on what else you're doing in conjunction with it. Are you using good products? Are you doing like microneedling or chemical peels or anything else? If you're not doing anything, like you're not using products and you're only relying on this, I would do it every year because you're only relying on this. But if you're using other things, we can probably push it out a little bit farther, depending on how much loss there is. If there's a lot of loss, we might want to do the two a little closer together, and then you can kind of space it out from there. But again, that's what the consultation's for, so that I can really evaluate you and see what is the best. And I know like some of those before and after photos flip through. You probably saw me in there. I was one of them. I'm almost 50. For me, it was lifting the lid. It was working, on my neck area, really trying to help with that. So I will do it about every 2 years, but I'm also doing microneedling, chemical peels, other things that are also helping to keep things stimulated. I'm going to go to another question here. How do you space this treatment with microneedling and other lasers? Great question. So Sofwave kind of fits everywhere, like anywhere in between any of it. It'd be more like when you say other lasers. So when you say, how do you space the treatment with microneedling or other lasers? I'm going to think of that question as, when would you do one versus the other? So like microneedling, you could do that and, 4 weeks later do a Sofwave treatment. So that's one of those things where it doesn't hurt anything to, do them a little closer. If it's a laser treatment and you have more downtime with that laser treatment, depending on the laser treatment, we might need to work around that a little bit, depending on the downtime that, that would be involved. With Sofwave, there is no downtime. Fillers and injectables, those are ones that we need to space a little bit differently. I always say do Sofwave first, then you could do the filler, or do the filler, give that time to really settle in and do its thing. Then you could do Sofwave. So I'd almost wait like 8 weeks after you have the filler put in to do Sofwave, because we don't want to change the integrity at all of the filler that's being used. Let's see here. Does the procedure have to be repeated at 6 months? So no, it does not have to be repeated at 6 months. It's really one of those things where you do it once. It takes 6 months to get that full result from that one treatment. If there is a patient that has a lot of loss of elasticity and wants it to be even tighter, you could do another one in 6 months. But a lot of all the before and after pictures that we've shown, they've only had one treatment. They have not had the other treatment or another treatment done after that, besides like a maintenance maybe down the road, because we've been doing Sofwave for about 3 years. How many sessions does it take to see results? So it really only takes the one session, but you have time in order to get those results, because any microneedling is the same way. Most laser treatments are the same way, because it's delivering the energy down to that mid dermis. It takes a while for your body to truly restructure from that thermal damage that it's reading. So it could take 8 weeks and you start to see a change. And then the next 8 weeks, you see even more of a change. By that 6-month point, you really see what the full result of that one treatment is going to do. It's somebody else asked, so are there 3 treatments in total? No, there's one treatment. One treatment is all that's done. When you come back in 8 weeks, we just take pictures. When you come back 8 weeks after that, we take pictures again, because we're just following your results from that one treatment. After that, again, it's a maintenance when we decide together what's best for you and what other things are you going to be doing or not doing. Somebody else asked, how long does it take to do a face and neck treatment? That takes about an hour and 15 minutes for actual treatment time. We numb you for about an hour beforehand. So you'll be in with us for about 2 hours and 15 minutes to 2 hours and a half. It does take a little while to like go through the treatment. It's not, lots not really happening. It's me sitting there for like 6 seconds, moving it again, 6 seconds, moving it again, 6 seconds. And a lot of questions, I also get a lot of questions on how does it feel? So during that 6 second of a pulse, because you have the numbing cream and we use the numbing cream for that hour beforehand, it makes things pretty comfortable. There are a few areas that some patients mind more than others. I know, like when we do the brow bone here, that is usually a very sensitive area. We use a device that's called a Zimmer, which is like a cooling spray, or we use a fan also, depending on what location we're in. That helps to cool that area, and it kind of just eases the discomfort if you feel the discomfort. I have treated lots of people. Some people find it uncomfortable for about 1 or 2 seconds of that pulse. Others don't feel anything. So it just depends on the person and the area that I'm working on, and just how sensitive you are versus not sensitive. Some people will be like, I'm so sensitive, I know I'm going to feel this, and they don't feel anything. So it doesn't necessarily mean anything. If you feel like you're sensitive to other things, you still might not feel this. So everybody's different. Let's see here. Is the first treatment just a one-time treatment, then with subsequent treatments every year or so, as you explained earlier? Yes. So you have the first treatment done, and then down the road, it would be whether or not we want to maintain it yearly, every other year, every 3 years. Again, it just depends what else you're doing along with it. So it's always only one treatment. And then from there, we just decide how are we going to maintain it. The only time, because somebody asked a question about would they need to have another treatment in 6 months? That is only if that person, the expectations, if they have a lot of loss of volume and they want to get maybe a little tighter than what they hit at that 6-month point, we could do another one at 6 months if they decide to do that. But most people don't. Again, those before and after pictures that we showed, they were only the one treatment. Nobody had any other treatment done. Are the eyelids treated as part of the facial treatment or is that a separate treatment? So when we do a full face, we do the eyelids during that treatment. Face and neck would be full face, including the brows, as well as the neck. So can this promo be combined with a VIP program? So we do have a VIP program. It is not combined with that. So it's a $500 off voucher that you would be paying for the full price of the face and the neck. It's not included with that program. How painful is it? Do you numb the face? I always wanted Botox, but terrified of needles. Would this be a better option? They're a total different option. So let's see here. I talked about how painful it was. So most people are pretty comfortable with it. We have a few people that mind it like that 1 or 2 seconds in certain sensitive areas. We do numb the face. And the question with the Botox, I always wanted Botox, but terrified of needles. Would this be a better option? So Botox works on a muscle moving. That's not what Sofwave is doing. Sofwave is lifting, tightening, thickening the skin. Botox works on an expression line. So forehead lines, crow's feet, glabella lines. Sometimes, when somebody's pulling down here, we'll use it to kind of lift that up. So they're more for a muscle. Sofwave has nothing to do with the muscle. It's more for that loss of elasticity. So let's see here. So a price for a face and a neck, just so everybody is aware, it's $3,700. And with the $500 off, it'd be $3,200 for the face and the neck. And should you get it before or after a scheduled Botox treatment? So you could do it definitely right before. That wouldn't affect anything. If you had Botox, I would want to wait a week after you had the injection of the Botox done to have the treatment done. Does this work for marionette lines? So it will work for marionette lines. Again, I need to do a consultation with you, or one of us providers needs to do a consultation with you to see how deep those marionette lines are and what's really causing that. Is it loss of elasticity? Is there a lot of volume loss? It will help to soften them. It does help to lift this area up. So you do get an improvement on the marionette line. So again, we just have to see you and really evaluate you in person. Another person asked, how much is it? I did talk about how much the face and the neck is. If you decide you just want to do brows, it's $1,900. If you do just neck, it's $2,100. If you do just face, it's $2,300. And again, if you're going to do face and neck, it's $3,700, but it's $500 off if you do it from this webinar. Okay, let me see if there's any other questions on here that I did not get to. There are a bunch. One question is, are there any side effects or risks associated with Sofwave? No, I have never seen anything that is a side effect, and there really isn't any risks that are involved. So it's nice because there is no downtime. It's not making you red or raw or irritated. I'm not causing a wound at all. Like, it's all happening from that heat underneath the surface. So it's not something that we really have to worry about with these risks and side effects. And another question is Sofwave effective for skin laxity and fine lines, or does it also work for deeper wrinkles? So it is amazing for the skin laxity and fine lines, but it does also work for the deeper wrinkles. So for these necklace bands, if I know we went through those pictures kind of quick in the slideshow, but on me, you can really see how much of an improvement it did for my before and afters on my necklace lines. So I will show you them in person so that you can really see all the pictures. We have a lot of patients that have had Sofwave, and we have a lot of before and afters. And some people are like incredible results, and some people show improvement. And I like to show where they showed improvement. And some areas, maybe they had a little bit and someone else had a lot. So that's why I like to show all the different pictures so that you can see how different everybody was and where they really responded versus someone else that responded here. Because again, I don't have a crystal ball. We're delivering that heat down into that mid dermis, and we just need your body to really stimulate that collagen. So the more we do with it, like if we're using products that help to stimulate collagen, the more that's going to come up from it. Let me see if I missed anything. I think I got them all. All right. As a reminder, you will be receiving a text message. Please reply with the code LEBO to be contacted for a consultation. I really appreciate everybody for coming and watching. I hope everybody enjoyed it. And I hope you have a wonderful night. And please feel free to set up that consultation. I'd be happy to meet with you and answer any more questions in person. You guys were amazing. I love all the questions. I hope you have a wonderful night. Thank you so much.